In Pakistan, and a look at rehabilitation efforts for victims of acid attacks. Now, such assaults are common in South Asia as a form of domestic violence. Channel News Asia's Hina Said has the latest.
Enhancing beauty is all about taking care of the small details, a pimple, a wrinkle or a grey hair. But it's unusual to see scarred faces working to make others look and feel beautiful. Such faces are unfortunately becoming a more common sight in Pakistani society, where men sometimes subject women to torture and violence for nothing more than rejecting a marriage proposal or not bringing a large enough dowry.
चपटी के ऊपर कपड़ा लगा के तो उन्होंने मेरे फेस पे लगा दिया. उन्होंने मेरे गले में कपड़ा बांध के तो मुझे यानी कि पंखे वाली जगह नहीं होती वहाँ लटका दिया और घर को आग लगा दी.
हमारे मोहल्लेदार था, वो पहले मेरी आपी को लाइक करता था, बट उस दिन आपी साथ नहीं थी, तो ऐसे वो अचानक से सामने आया और उसने इसे फेंक दिया और उसके बाद मुझे हॉस्पिटल लेके गया.
Not all victims are lucky enough to survive the attack, but those who do survive struggle for rehabilitation. Over the past 10 years, the Smile Again Foundation, a project of duplex salons, has treated and rehabilitated more than 500 acid victims across Pakistan in an effort to restore smiles to their scarred faces.
A girl inevitably goes through 30 to 35 surgeries to look better. Not normal, but to look better. When their vitals are restored or their movements are better, we start training them in some kind of skill, and that some kind of skill could be anything. If they want to become beautician, I would make them beautician, although there's a lot which is needed to be done rather than just giving them beauty courses, because we have to change the mindset of the society also.
One success story is that of bottle manufacturer Sarwari Bibi, who is an independent working woman. She suffered an acid attack 23 years ago that left her face completely disfigured, and she even lost an eye. Like many other acid victims, Sarwari's journey towards rehabilitation is not only painful but time-taking as well. Yet it's her courage and determination towards life that is inspiring for the victims as well as the society. But then there are others who need support. And while Misbah's salon and house are always open to such victims, the numbers that can be treated there are limited. Officials at the Human Rights Commission of Pakistan say the country should try to adapt the national level rehab models being practiced elsewhere in the region.
I think the best are in Nepal, and it can be followed by Bangladesh, and even Sri Lanka has better facilities. We should not replicate them, but we should provide more facilities, like for opening vocational institutions, for providing them scholarships to study and to work.
Experts say that changing the position of women in Pakistani society may be the first step towards eliminating the acid attacks, but in Pakistan that first step may be a giant leap. Concerted government action needs to be undertaken to rehabilitate the physical and mental scars endured by these victims so they can heal and become contributing members of the society. Hina Said, Channel News Asia, Lahore.